This is Pet Life Radio. Let's talk pets.
Hello, everyone, and welcome to Cattitude. I'm your show host, Michelle Fern, and guess what? We are at VMX, and I finally got to meet Dr. Dana Varble in person, and we're going to ask her some questions about VMX. So nice to meet you in person.
Oh my gosh, Michelle, it was so, I'm so happy you're here. I'm just so happy you're here. I really am.
Well, this is new for me, my first time here. So for everybody listening, because, the Cattitude listeners might be thinking, what in the world is VMX? So what is it? And also your title, because you are a big shot here.
I'm not, though, because Michelle knows I'm just a veterinarian, and we're just always like,
No, but you're like Chief Veterinary Officer.
I am.
You have all these titles. A VAMC. That's a big deal.
I'm Dr. Dana Varble. I am the Chief Veterinary Officer here at North American Veterinary Community. Every year we hold the world's largest veterinary meeting, and we are here at VMX, the Veterinary Meeting and Expo for 2022. And I'm so glad that Michelle got to join us this year.
Well, I'm thrilled to be here. There's all kinds of veterinary advances here. This is where all the veterinarians go, the vet techs, the veterinary students, right? Mm-hmm. Who have I missed? Mm-hmm. Press, like me.
Practice managers, veterinary leaders, folks who are developing medications and new tools for veterinarians to use. Everybody's here.
Okay, and everybody listening, we're Cattitude's about cats. So you might be thinking, okay, so how does this involve me? How does this involve cats? Well, a lot of these advances are about cats. So now there's a lot of, it looks like some of the highlights for this year, emergency and critical care with cats. What's new with that?
What's new? So one of the most exciting things we've been talking about in emergency and critical care is, most of your listeners probably know, like, there's Red Cross CPR classes. And in those, you learn about how to do CPR correctly, right? How it's going to be most effective. Well, here at VMX, we're actually teaching veterinarians, veterinary nurses, and technicians how CPR can be most effective for your cat. So God forbid that your cat ever needs CPR. We want our professionals to be trained in the absolutely best techniques, the best ways to potentially reverse that life-threatening situation.
Now, can the people that are being taught it here, can they ever teach it to the, cat pet parent at some point?
Of course, yeah. This is the first step in their CPR certification journey. So the first thing they do is just learn all these techniques, all these standardizations, all these improvements themselves, and then they can go on to become a certified instructor. The nice thing about that program is they do have an option for pet parents to learn CPR as well, because of course, if you need CPR, it's an emergency and it's usually very urgent. So we want as many people as possible to be trained in these techniques.
And definitely good thing to know.
Yeah.
Okay, let's move on because I know your time is precious, especially here. Cardiology. Okay, feline heart disease is a big thing. Mm-hmm. And I noticed nursing the pacemaker patient. Pacemakers in cats now.
Pacemakers in everything now.
Everything.
Can you imagine that? Yeah, just about. Well, I should say cats and dogs. We haven't moved to pacemakers and really fun stuff like horses and bearded dragons. Not yet, but give me a few years. We might be introducing stuff like that. So it's amazing to think about. But yeah, pacemakers are actually, animals do really, really well with pacemakers. There are a few heart diseases, just like in humans, where the rhythm of the heart gets off and it needs a little extra help. So the interesting thing about pacemakers is being designed for humans, they're designed to last for a very long time, 5, 10, 20 years. Well, 5, 10, 20 years in a human means it's going to have to be replaced, right? But Michelle, looking at me, she's nodding already because she gets
cats,
it.
Right?
For cats,
they might need only one pacemaker by the time they're that age. So
yeah.
Dogs especially, they live shorter lives.
Absolutely. Cats and dogs, this could be one time to really affect how long their heart can exist with this abnormality and be corrected and be safe and live a normal, happy, healthy life. And actually, for the funny thing is these units get placed under the skin. Well, think about human skin compared to cat skin. Human skin is really attached, right? There's not a lot of space underneath it. But anyone who's pets a cat knows how loose their skin is. There's so much space under there for a pacemaker. They're almost better than humans. Isn't that crazy?
I'm thinking about my cat Molly. She has this hanging belly, and I thought it was fat. And then I did more research. They have hanging bellies.
They have extra skin.
A
Yeah,
lot of
their
extra,
skin is
in
so
better
different.
terms, extra skin. Yes.
Yeah.
So yes. Okay. And here's something that I just was looking at the different things that you have going on. Okay, this only relates really if we can call it catfish, but no, there's a lot of types of surgery that veterinarians do that pet owners, we barely have a glimmer into what goes on because we focus on mostly we have Cattitude, we have cats, maybe we have a dog or two, but fish.
Yeah.
And you just shared some pictures of your fish surgery. Yeah. I thought, okay, let's talk about make it cat related, catfish. I can't even imagine catfish. And before I saw your pictures, I thought, how do you do that? Is it underwater? How do you do that?
It'd be really hard, right?
I know we're about cats. So just pretend this is about a catfish, even though it's not a cat. Just a real quick.
Yeah.
Just because this, I think people are going, what the? How do you?
Yeah,
so unique.
It is. I think a lot of people don't really even see how much we could do on these catfish. It's really, really quite fun, actually. There's anesthetic solutions that are developed for use in water. We can take these wonderful catfish out of water and put them on a surface that's not going to injure them, typically a sponge, and continue to deliver that water with the anesthetic chemicals into their gills via a tube with a syringe and perform surgery on them just like we would on a cat or dog. So if you think about it, it's sort of similar. In a cat or dog, we deliver anesthetics typically through gas, right, through the air. And in a fish, we do the same thing. We deliver anesthetics through the water. So we don't put our scuba gear on. That was a joke. We do it all out of water, but we kind of bridge that gap. They stay in the water and we stay in the air, and we manage to be able to help them quite a bit.
Well, that is truly amazing because I didn't even know that was a thing, that you could do surgery on fish. To wrap it up, every year there's more and more innovation in veterinary technology. Mm-hmm. And I think back just to even from just a pet parent 10 years ago, just 5 years ago, the things that have been changing. Mm-hmm. What are like maybe one or two things that you've seen, maybe last year, even this year at VMX, or maybe in, just that you've seen that have just made your mind go, oh my gosh, I can't believe we're doing it. It's about time. I'm so glad.
It's going to change the game. Yeah, I mean, you're right. I mean, Michelle, there's so many. It's almost hard to pick one or two. Just this week, I'm hearing about new pain medications for cats that are approved and have been studied. And just even that for me, for your listeners, cat pain has always been a pain point. I'm sorry, that's a terrible pun. But it's hard to treat cats for pain. The side effects from the medications can be severe and maybe not always worth the risk. So just hearing that there's new medications out to treat cat pain, pretty remarkable. And the other thing I think that really always just makes me amazed is, it used to be when we found out our pet had cancer, it was devastating. It was, how long is it? It was they're going to be sick, they're going to be in pain, they're going to be hurt, they're not going to have a good quality of life anymore. Hearing all of the amazing new medications, new chemotherapy drugs, new radiation treatments that can change the cancer diagnosis from one of despair to one where maybe there's some hope. Maybe there's treatments that we can use that aren't going to make them sick, that aren't going to make them have stomach upset or be sad or be lonely or be in pain, but are actually going to take away the way that cancer is negatively affecting their health and give them a chance to live a good quality of life. Because that's what I really want for pets. We're lucky with cats, right? They can live 18, 19, 20 years. And I want all 20 years for a cat with cancer to be wonderful. I want them to be amazing. So hearing that is just, it makes me so excited. It makes me so excited for your listeners, too, that they're going to have these things as real options, not something that maybe only a few people can afford or maybe are only at the really specialty centers, but maybe available to a lot more people.
Okay, you hit on one more thing. Sorry, I always squeeze one more thing in, but really quick.
Good.
You hit on afford. And it used to be if your pet had cancer, yes, it was kind of,
Absolutely.
kind of, I hate saying the words, but death sentence. Your pet
Pie
wasn't
in
going
the
to last
sky,
long,
right? Yeah.
or it was going to be you'd have to get a second job or something,
Yeah.
With all these innovations, do you think in the future costs are going to go down or definitely be more reasonable than they are now?
Yeah, I mean, I think two things are to our advantage there. I mean, I think one, the old technology that we used to use is changing, right? Things that are big, things that, a regular vet couldn't purchase, that had to be, again, were only at specialty centers, only in big cities, only available rarely. Now, because those machines or those techniques or those drugs are getting more available, now maybe more people will be able to get to them. So that's the first part of that. But the other part, and I think this is probably where there's even more promise, is some of these new techniques for radiation, some of these new techniques for chemotherapy. These drugs are newer, so you think more expensive, but maybe they only have to be given once. Maybe they only have to be given a handful of times. So instead of committing to radiation treatment that's going to last 6 weeks and you're going to have to go to the vet every day and it's going to be really expensive, maybe you only have to go 3 times. So just by that alone, even though they may be new, they might be so much more efficient, so much better, that now a lot more people will be able to afford them. Yeah.
That is good news. Thank you so much for taking the time to speak with me. And it's always a pleasure. Have a wonderful time at VMX.
Thank you so much, Michelle. It is great to talk to you every single time.
Same here. Likewise. I always learn so much. I mean, who knew you could operate surgery on a fish? I wouldn't have thought it. Anyways, thank you again. Till next time. Bye-bye. We're going to be right back after this word from our sponsor. Molly, here's your dinner. Zeus, that's not your food.
Don't let that happen to your precious cat. Elevate your cat's eating experience with the Cat Tree Tray. The Cat Tree Tray keeps your cat's food off the floor and conveniently located on the cat tree. It's the perfect way to eat. It's a beautiful wrought iron tray that easily attaches to your cat tree and keeps dogs and other critters out of your cat's dish. A must for multi-pet households. There's a 6-inch tray for large bowls and a 4-inch tray for smaller bowls. Purchase your Cat Tree Tray today. Go right now to cattreetray.com. That's cattreetray.com. cattreetray.com.
Let's talk pets.
Let's talk pets
On Pet Life Radio.
Pet Life Radio.
PetLifeRadio.com.
This is Michelle Fern at VMX, and guess who I have with me? The one and only Dr. Jeff Werber. Okay, he's one of my favorites, probably my favorite. If at Pet Life Radio, you all know him. He hosts Ask the Vet with Dr. Jeff, which is live on Sundays. But today's special Sunday, we're live at we're talking at VMX. Right. So, Dr. Jeff.
Hopefully we're both live.
Yes, we are both live at VMX. Although the interview won't be live, but that we'll do it later. Okay, so what have you seen? You've been a veterinarian for how long?
This is my 38th year.
Oh, my God. And you look like you're, 20-something. How do you do it?
Such a doll.
Okay, so what have you seen this year that has made you go, wow? And having been a vet 38 years, it has to be something amazing.
Oh, no, there's so many new things happening.
Especially for cats,
especially
if possible.
Cats. Well, first of all, we know that cats, like dogs, also can get cancers. And one of the treatments that are often used when it comes to human cancer is what we call stereotactic radiation. That means you take radiation, radiation therapy, which is commonly used in cancers, but the area that they radiate is usually a broad area because that's all they could do. Now with stereotactic radiation, they can pinpoint the tumor using either CT or MRI and actually direct the beam directly at that tumor and only that tumor. So we have what we call less scatter. That means it's safer for the animal. It's safer for the tissue around the tumor. It is safer for the assistants that are helping with the radiation. So basically, it's a wonderful way that we can enhance cancer treatment by using stereotactic radiation.
Is this treatment closer for animals? Sounds like it's a lot closer to treatment that is done for humans.
Oh, definitely. I mean, so many things that we're seeing. In fact, there was a study that I reported on last week where they're taking embryonic cells from pig embryos, okay, before they've had a chance to specialize. So if you would take one such embryonic cell and put it into a spleen in a different species, it would become a spleen cell of that species. If you put it into the liver, it would become a liver cell of that species, where it's almost like a stem cell. It hasn't yet developed what type of cell it was going to be. And they all start as just embryonic cells. So what's so cool is there was a calf that was having some sort of brain dysfunction, like a seizure. They took the pig embryonic cells, transplanted into that area of the brain that had the abnormal cells, and took care of the problem. This was done on an animal. Well, guess what? Now they're saying, wait a second, we can take this type of therapy and use it for people that have epilepsy and replace the cells and the epileptic focus with these embryonic healthy cells that will develop into healthy cells and maybe treat epilepsy in people. So when you think about stuff like that, it's not always, it happens first in people, and then we train it to animals. It's the opposite.
That's what I was just thinking of, because, the first time we talked about, it's something that we did in people, now we can do in animals,
right.
Now vice versa.
Right.
So it's like huge, wow. I mean,
even when you think of some of the diseases, some of the vaccines that are developed for animal diseases, they're using that same technology now for similar viruses and bacteria in people. And it's not a matter of, well, you're always learning from us. We have amazing research teams that are working sort of at the same pace at the same time, and whoever gets there first can share the technology. Sometimes it's the people technology, it's helping the animals. Sometimes it's the animal technology that's helping the people.
And there's been so many, I'm just thinking, since you've been a veterinarian for so many years, the things you have seen change. What have you seen? Let's do this. Let's do better and worse. What have you seen? Let's always start positive. So what have you seen change for the better? I mean, there's a bazillion things, but maybe nail it down to one or two, especially for cats.
It's so difficult. I would say, one of the cat diseases we see a lot of is hyperthyroidism, okay? And again, let's take the human animal, who did it first. So now we are using the therapy for cats. Now, I remember when I graduated, there were two choices for hyperthyroidism in a cat. One was a medication called methimazole. I never liked it. It's a Band-Aid. It's not even a good Band-Aid, but it's a Band-Aid. It works, it's better than nothing, but it's not so great. What I used to do the surgery where I would remove the thyroid gland, trying, of course, to salvage the parathyroid gland, which is right on top of the thyroid gland. Sometimes you could, sometimes you couldn't. Fortunately, there's ectopic parathyroid tissue that takes over, and sometimes you supplement a little bit after the surgery, but ultimately the cats do okay. Now, what are we doing? Radioactive iodine, the same way they treat people. And it's unbelievable. And what's so great about cats is that you can radiate the area, right? It's radioactive iodine. It attacks only the portion of the gland that is over-secreting. It doesn't touch the other part of the gland, meaning that after treatment, you have what's called a euthyroid cat, normal thyroid, and they can live on the rest of their life.
That's amazing. Now, okay, little negative here. What have you seen change that you find as a big negative in the veterinary community for cats?
Well, I don't know if there was anything necessarily for cats, because most of the stuff, by the time you learn, there are improvements. There are improvements in how we treat. I mean, for example, let's take the disease, just the name, FUS. Yeah. No longer called FUS, feline urologic syndrome. Now it's FLUTD, feline lower urinary tract disease. Why? Because now we know that has nothing to do with the kidneys. It's all about the bladder and on down. All right? And when there were problems with the stones and crystals blocking male cats.
Whoa, that happened to Dennis, and we didn't know what it was. And one place told us to put him down.
No.
And one place just snipped him.
Right.
But it was, if we hadn't done it in time, it would have been fatal.
Of course. So now you mentioned snipped him. So we just do what's called a PU, a perineal urethrostomy, basically amputating that very narrow tip of the male penis, and it opens it up like a female, and so it changes the plumbing a little bit, widens everything. Well, guess what? You know how many times we have to do PUs now? Hardly at all. Why? Because now we learn so much more about the factors that cause this, including diet, that we can prevent the problem. And where PUs were very commonly done, now, I mean, we still have to do them, but not nearly as frequently.
This was probably at least about 8 or 9 years ago.
Now, I mean, it's certainly not obsolete. We still have to do them, but much less frequently because of our understanding improvement. I guess in general, the only thing that I guess I see as a change that I'm not really thrilled with, and not necessarily just cats, but in general in veterinary medicine, is the specialization is so narrow now that a lot of graduates are not graduating with the skills that people from my era had. And they're afraid to do things. They're afraid to do surgeries that are really not that difficult.
Does that mean like on all animals, or now they're specialized, say, only on dogs or cats?
I would say certainly in the common dog and cat, companion animal practice of what I see. And I see young veterinarians come in, and like we might hire a relief vet if one of the docs is on vacation or whatever, and they say when they even fill out their form what they do, I'm not going to do any surgery. I'm only going to do maybe a spay on a cat under 10 pounds. I mean, it's like ridiculous to me.
Under a weight? Under
because
all
they're afraid
that?
When they get too big, they won't do a dog spay over a 35-pound dog. It is mind-blowing.
My mind's blown, and I don't.
Yeah.
I'm not a vet. That's crazy.
It is so crazy. And,
do you think that'll change? Because that sounds nuts.
I really think it's the function of the schools, the veterinary schools, and because of specialization, they're encouraging that doctors to do, general practice doctors to do this much, and everything else refer to the specialist. And I'm saying, wait, no. Because if you're in an area that doesn't have a specialist nearby, we need to be equipped.
Right. And just because, if your dog is 40 pounds, which is, that's pretty... I can't say it's average, but it's just trend. It depends where. You're in a city, you might have a smaller dog because they're in apartments. Otherwise, so what if you have two? I used to have when Mr. Zeus was alive, 45 pound. Right. Then Nikki's is 15 pounds, so I have to go to two vets.
Or you have to. They would send the bigger dog to maybe a veterinary surgeon, which is you don't need a veterinary surgeon to do a spay. I mean, I think that comfort level that I had graduating 38 years ago is very much different, and the expectation of what I should need to know how to do is very different. And I think it's hurting the profession. I really do. And one other thing is, again, I'm going to get a little controversial here, which like on my show I get to be because it's my show.
It could be controversial. What the heck?
Is now with COVID, I think that a veterinarian has to make a decision. Yes, you want to have work-life balance. The world right now, we're going through a lot of changes because of COVID. And when someone calls their vet and they are told that, I'm sorry, we can get you in the last week of February. Will that work? Well, last week of February, my dog's been vomiting for 2 days. I need to see somebody now. No, I'm sorry. And then they start calling other hospitals. Oh, no, I'm sorry, we can't take new clients.
Now, is that for people being sick or like calling out? Is it for people just...
I think it's, my personal opinion?
Yeah.
The inefficiencies at the hospital level because of not seeing clients in the door, in a room, making them wait in the car, running back and forth. The technician or the nurse is running back and forth. And instead of that 20-minute appointment, half-hour appointment, now it's 2 hours. So instead of seeing 30 or 40 a day, as I do, they're seeing 10 a day. And there's such a backlog. I mean, yes, you want a work-life balance. That's great. When things are good, have a work-life balance. But now our passion, our concern should be about our patients. So if I have to stay till 7 o'clock tonight, I'm staying till 7 o'clock. I have to make sure they're seen. And it's a mentality that is unfortunately lost in the new generation.
And so this scares me because I've experienced, the new school and old school at my vet when Zeus was really sick and before he passed. And this is nothing against new veterinarians right out of school, but there's a different mindset. And I'm with you. I'm old school. I just think that there's a lot to be learned, and it's not necessary that they need a ton of experience, whatever, but I agree with you. If this is what you're doing, this is your passion, this is it, do it. And the idea you're specialized just on size of dog, what are they going to do next? Breed? I only take poodles, there's 50 million breeds, right? Cats, I only take, Siamese. Oh, it's a mix. No, there's another vet down the street. I mean,
it is.
It's crazy.
It does. But one thing, the good thing for the cats, we're seeing a lot more all cat practices. And you mentioned about having two vets. I have some now. I do a lot of cats. I'm about 55-45, dog to cat, only because cats usually need a little less care, generally, routine care. They hide their diseases better than dogs anyway, so it's a problem. But no, my cousin was one of the first all-cat practices in New York.
That could be good because then that when you're specialized, especially with cats, because they're hard to do.
Right. And also, that was more of a function of A, him loving cats, B, the space that you need for a cat practice is smaller, and the calmness of walking into a vet hospital when you're an all-cat is a little different.
Right.
You walk into my hospital, the dogs are jumping all over the place, and they're running, and they're barking away, and they're, where's the cats come in? They don't peep, maybe they're a little meowing, they're in their carrier, it's quiet, it's clean, so there's something to it. But I love, people say, am I a cat person or dog person? I'm a both person. I have 5 cats, I have 5 dogs. I'm just equal opportunity.
Well, thank you so much for coming on Cattitude. Have a great time at VMX. It's always so wonderful to talk to you.
And always great to visit with you, Michelle. And I have to have you on my show again. So we have to
to do that very soon. And folks, if you have not listened to Ask the Vet with Dr. Jeff, for some reason, if you cannot make the live show, the shows are all posted. They're on Pet Life Radio and anywhere else you can hear the podcast from Pet Life Radio, a bazillion places. Ask the Vet with Dr. Jeff, Dr. Jeff Werber. Dr. Jeff, he knows so much that every time I talk to him, I learn stuff. My mind is blown. So be sure to take a listen to his show. All right, have a great time at VMX.
Thanks. We'll see you soon.
So I want to thank my cat crew, Dennis, Charlotte, Molly, Jethro, Sammy, and hey, Nikki too. He's the dog. Keeps everybody in line. They've taught me a great deal about cats. And thanks to everyone listening. Thank you for making Cattitude such a popular cat show out there. So many people listening. And keep the emails coming. Michelle at PetLifeRadio.com. And a special huge thank you to Mark Winter for making me and my guest sound amazing. And remember, lose the attitude. Have Cattitude.
Let's Talk Pets, every week on demand, only on PetLifeRadio.com.